Now let's answer this question. Right. So this is the body of your question. This is the stem of your question, and then this is your answer keys. Now, the body of the question, the information is for you. This is for the examiner, and your answer key is going to give you extra understanding. Right. So you need to know that. Now, the body of your question contains the NCLEX content. For RN, we have 146 content. For PN, we have 150 content. Right. So if you join my coaching program, for sure, you get access to this content. Also, you can get the content on the NCLEX test plan. You just need to download the test plan for RN or PN. But what you get in my coaching program is the explanation to each content and what the NCLEX is going to test you. Now, the body of the question, I tell my students that you need to understand what content the NCLEX is testing. Right here, if you read through the question, we have two contents: change of shift report, client in label. Now, anytime NCLEX, this is why I tell my students, anytime NCLEX is testing you on change of shift report, you are reporting based on something. Right. Change of shift report don't just stay on its own. Either you are doing a change of shift report concerning a client problem or a certain what situation. In this case, there's no problem, like there's no diagnosis or any kind of thing going on with a single patient. Instead, you are trying to care for a certain situation that is occurring what with clients in labor. So the change of shift report, we expect the NCLEX to test us on something, but these are another content on the NCLEX exam. So it means that the NCLEX is testing you what? Client in labor. So it's a situation that is occurring. Now, that is when you now, because in my coaching program, I've explained everything NCLEX is going to test you about client in labor. Now, at this point, you now need to start reminding yourself about the information you have studied in my program about client in labor. Now, that way you cannot be able to answer the question. Now, we know this is what the NCLEX is testing, what? Client in labor. Now, look, the next part is the stem, which is what? The examiner question. The first part of your question is not your question. Right. It's just like the scenario that introduced what the content NCLEX is testing. Now, this is the real question, right? The examiner question. Now, the examiner is saying the charge nurse should ask a staff member to first see the client in. So, where are the client? This is client 1, client 2, client 3, client 4. Now, anytime you have your question in a certain way that you can structure it, please structure it. This is first stage, second stage, second stage. So find out what is going on within the first stage. Vital sign contraction. Vital sign contraction. So NCLEX is testing you on what? Vital sign, and NCLEX is testing you on what? Contraction. Right. NCLEX is testing on contraction. So you need to know vital sign, because I wish you to tell students this. Vital sign is not general, in a sense that the range are not general. There's vital sign you need to know for maternity. There's a lot in maternity. We have 3 vital signs you need to know in maternity. You need to know the one for pregnancy, you need to know the one for labor, and you need to know the one for postpartum. Right. Same thing for pediatric as well. You need to know the vital sign. For pediatric, you need to know 2 vital signs from birth to 3 years, and then from 3 years to 17 years. And then you need to know for adult. Adult is the regular one we know, right? And you need to know for COPD, because oxygen for COPD is 88 to 92%. Now, so you want to apply the vital sign for labor, because NCLEX is testing you on labor, and you want to apply your knowledge about contraction. Contraction, we have frequency, and then we have duration for contraction. So frequency is what we call every, and see what the NCLEX is using right here. Duration is what we call lasting, and see what the NCLEX is using right here. So NCLEX want to test you on the if these are expected or not. Now for frequency, we have 2 to 3 minutes. For duration, we have 60 to 90 seconds. Anything less than 2 to 3 minutes is a problem, and anything greater than 60 to 90 seconds is also a problem. This is within range, so this is out. Now, this is vital sign, vital sign. Vital sign for temperature should be above 100.4 degree Fahrenheit to be a problem. This is still within range, so this is out as well too. Let me clean up so that we have a very clean sheet. Now, this is within range, so this is out. This is within range, this is out. Now we are left with this, we are left with this. Right. Respiratory rate during labor is expected to be higher than 20. So this is expected, so this is out. We are left with 2. Now, remember I said anything less than 2 to 3 minutes for frequency, which is also known as every, is a problem. Now you can see 30 seconds, that is less than 2 to 3 minutes, so it's a problem. So 2 is the correct answer. Now all these things I have them on my my coaching program, whereby I explain, even if the NCLEX is going to test you on other things under client in labor, you are well prepared. Most students struggle with maternity, right? And NCLEX is not testing you on everything under maternity. NCLEX is testing you on specific thing. Most especially, NCLEX want to test you on antepartum, right? Intrapartum, and then postpartum, right? So this is what the NCLEX just want to test you. We just go to talk some kind thing. I want to make this video and send it. So this is my first video. I'm making it and I'm sending it. Now let's talk about this question. Right. So this part of this question is your body. Now, the body of the question tell you the content NCLEX is testing you on. Now, if you don't know about the NCLEX content, you need to go get what? The NCLEX test plan. You can look it up online, right? You are going to get one directly from the NCLEX website. Either you are taking the RN or PN. You're going to get the one for RN and PN. RN have 146 content, PN have 150 content. Now, those content, you are going to see it what? Directly when you are reading the body of the question. Right here, we have 2 contents. Change of shift report and then client in labor. But one thing about change of shift report is that we need to know what we are reporting on. So that is the reason why the NCLEX is saying change your shift report for the following client in labor. So this is what the NCLEX is testing us, reporting what on the following client in labor. Now, so this is what the NCLEX is testing, client in labor. Now, if you are part of my coaching program, right? If you join my coaching program, I've broken down audio content for RN and PN. In my program, I broke down what? Client in labor. There are a lot of things NCLEX wants you to know, right? There's a lot. I'm really going to say a lot right here, but I broke down client in labor. Now, the NCLEX is now saying, because this part of the question is what we call your STEM, right? This part is for the examiner. This is your question. Remember, this part is not your question. This is your question. This part is not your question. This is just like a scenario that lets you to understand what you're about to do in the question, right? Or give you the content NCLEX is testing. Now you understand the content you are now about to apply, because NCLEX exam is application what? Exam. NCLEX want to test to see that you can practice and you are a safe nurse. Now the charge nurse should ask a staff member to first see the client in. So we have client 1, client 2, client 3, client 4. Right. So this is how I tell my student to break down question. I'm going to tell you what is going on in each question. Right here, the first part is saying first stage in labor, first stage in labor. So we can group this together. Second stage, we can definitely group that together. Now, what is the patient experiencing? Right. Temperature, respiratory rate. The NCLEX is testing us on vital sign, contraction. NCLEX is testing you on what? Contraction. Now you need to know vital sign, you need to know contraction. Now, number one mistake I have seen when students study vital sign is that they only know vital sign for adults. Now, even if they know vital sign for ped, they don't know that NCLEX break down ped vital sign into 2. We have from birth to 3 years, and from 3 years to 17 years. Right. Also, they don't also know that maternity, right, also have 3 vital signs. We have pregnancy or antepartum, we have labor, and then we have postpartum. They don't know. We have 3 vital signs as well. So now when you are knowing vital sign for the NCLEX exam, you want to know vital sign for birth to 3 years, 3 years to 70 years, and adult. You also want to know that COPD utilize 88 to 92 for their oxygen, right? And you want to know maternity vital sign, right? Most especially the maternity vital signs, you want to know abnormal vital sign during pregnancy or antepartum, right? You want to know vital sign during labor, and as well to abnormal vital sign during postpartum. That is what you want to know. But NCLEX is testing us on what? Client in labor. So we are utilizing vital sign what? During labor. Now, during labor, we have 3 important vital signs. We have temperature, we have blood pressure, and we have respiratory rate. Now, it's expected for respiratory rate to be increased. This is expected. Now, we don't want to see low blood pressure. We don't want to see low blood pressure. This is going to be a red flag, but it's expected for respiratory rate to be increased. Temperature that is greater than 100.4 degree Fahrenheit is a problem. So this as well too, if it is greater than this, is a problem. Now, let's pay attention to the vital sign that we have right on the question. Right. Now, if you look at the vital sign right here and the vital sign right here, you can see it's not greater, the temperature is not greater than 100.4. So this patient is fine, right? And respiratory rate is expected to be high during labor. So this is also what? Fine. Now we are left with contraction. Now let's talk about contraction real quick. Now, contraction, we have 2 parts. We have frequency and we have duration. Now, frequency also mean every. That's why you are seeing every right here. And duration also mean lasting. And that's why you are seeing this right here. Now, they have their normal range because NCLEX is testing you for the normal range. Now, frequency is 2 to 3 minutes. Duration is 60 to 90 seconds. Right. Frequency is 2 to 3 minutes. Duration is 60 to 90 seconds. Anything less than 2 to 3 minutes, if you're having something like 60 seconds, 30 seconds, it's a problem when it comes to frequency. But for duration, anything greater than 60 to 90 seconds, maybe you're having 1 minute, 2 minutes, it's a problem. Right. So this is 60 seconds, which fall within range for duration, which is lasting. So this one is fine. We've already done our Xing out 3, 4, and 1. So we are left with 2. So obviously we are definitely going to believe that 2 is the answer because we perfectly broke down the question. Now, if you look at the question, you can see 30 seconds. You can see it's less than 2 to 3 minutes. So this is a problem because the baby is at what? Risk. The baby is at risk. The contraction is too fast, right? Happening every 30 seconds. There's no resting period. So yes, that is why the answer is number 2. Now, so you can see how to break down question using structure. I tell students all the whole time, NCLEX utilize 3 structure, which we know as the body, stem, and answer keys. Right. We need the answer key to give us extra understanding, which we utilize in this particular question. The stem, we understand that it's a prioritization question from the way the examiner put together the questions for C, and body, we're able to get what? The content. This information from body is for you, whereby I tell you the content NCLEX is testing. Right. A lot of students miss out on the content because they don't know you're studying for the NCLEX exam. You need 3 phases. Now, phase 1 should be your knowing about the NCLEX exam. Phase 2 should be your planning, and phase 3 should be when you are studying. A lot of students don't do this part, so they don't know how to plan. They only focus on theory. That's the reason why they never feel ready to take the NCLEX exam. Right. So the first part is to know about the exam. That is the first part. You want to know about the exam. Now, when you know about the exam, that is when you understand that, NCLEX have content for RN, 146 content, for PN, 150 content. That way you know that, NCLEX have what? Content for the exam. Now that you know NCLEX have content, now you now want to know how they utilize the content to write the question, right? Because I tell students, this is why a lot of students fail the exam. I've been coaching for the past 2 to 3 years now, and I've helped 500 plus students pass the NCLEX exam, and 80% of this number happen to be students that have failed the NCLEX exam before. Now, the moment we can fix these three things, right, they pass the NCLEX exam. I use this same approach right here to help a particular student who have failed 14 times before to pass. Content, knowing how the NCLEX writes the question, understanding. Now, everybody can understand the content, but this is the best part. When you know how the NCLEX writes the question, you can understand the kind of answer NCLEX is one thing, then you cannot create that perfect understanding, right, about the question. Right. So that is how to approach your critical thinking. Now, you want to know how the NCLEX write the question, because this content, how the NCLEX write the question, and then you want to do your breakdown. Your breakdown is what I call your understanding. Right. The moment you can do that, then you are good. Now, with all this knowledge, all you need now is a coaching program. Right. All you need now is a coaching program that have broken down the 146 content for RN and the 150 content for PN. Because for PN, I mean, because now you can know client in labor, but do you know what the NCLEX will test you under client in labor? If you don't know what the NCLEX will test you under client in labor, you are still going to see that NCLEX is testing you on client in labor, but you will not still be able to answer the question, right? But if you join a particular course program that explains so well about client in labor and the thinking process behind any question that will be tested under client in labor, you are able to approach the question. Now, I've seen students make mistake answering this particular question whereby they easily apply ABC to it, and then they say the answer is 3. Whereas they did not know that in second stage of labor, respiratory rate is expected, and this is wrong. And this is the life-threatening situation that is going on right here, life-threatening. Right. So if you don't understand the NCLEX, you will answer question wrongly. And that's the number one reason a lot of students fail the NCLEX exam, because they don't take time to understand the NCLEX. And I do tell my students, if you are not understanding the NCLEX, it's just like giving a patient medication without not knowing what their diagnosis. You are putting the patient at what risk. So if you don't understand the NCLEX and you are studying for the NCLEX exam, one thing you find out is that when you are getting closer to your exam date, you will never feel ready. Now, when you happen to take the NCLEX exam, you will feel lost. You will second guess yourself. You can still pass, but you are going to struggle. But guess what? If you fail the NCLEX exam, how would you feel? You will not believe in yourself no more. Right. You will not know what to trust again, and you will be so confused. Right. So you don't want to go through that process of failing the NCLEX exam multiple times, or if you are taking it for the first time, failing the NCLEX exam. So this is the right time to do what is right. We can definitely fix the starting point, but the end point will definitely give you either pass or fail. So the end point, you cannot fix it. I saw somebody who took the NCLEX exam, right? Left the exam center, and she said she don't know how she performed during the exam, right? And she did what they call quick result, right? And the quick result gave her a bad what pop-up. And she started praying to God that God, this bad pop-up is not for me. This bad pop-up is not for me. Right. At this point, there's nothing God can do. Right. You have started the whole preparation. At this point, this is where you can involve yourself, right? Yourself and then God. Right. God is going to bless the work of your hand. So if you are studying, trust me, you are going to reap the aspect of your studying. Right. But if you are not studying right, God cannot still do anything about it. But God might be sending people your way to organize your studying, but you will be ignoring those clues because you are never ready to help yourself in the first place. So that's a big problem. Right. So that way, if you go like that to the NCLEX exam, you see bad pop-up, and you end up now saying God should change it. There's nothing God can do, right? God cannot change a particular result that is already failed. And then when the student came back, she said she failed the NCLEX exam. Now, will she now not believe in God no more because she failed the NCLEX exam? No. You understand? So if you definitely do things right, definitely you are going to get the right result. So let us try to study right. So that is the best thing I'm leaving with you. So if you struggle with the NCLEX exam and you need help passing the NCLEX exam, you can reach out to me, right? Can reach out to me +1767 613 0769 +1767 613 0769. Just send me this keyword ready. Right, send me this keyword ready. Just text me and send me this keyword ready. You can text me on WhatsApp, iMessage, direct text. Just send me this keyword ready and I'm going to respond back to you. So see you in my DM.